Hey guys, Tony here. So in this video, I want to talk to you about billing and the difference between billing a group therapy code 97150 and billing any other time-based code or therapeutic procedure. Let's take a look at what the literature is on billing group therapy because it's different than it is in skilled nursing, Part A facility, things like that. And I want you to see the value difference in billing for maybe a group of 10 using the code 97150 versus billing for maybe 4 to 6 individuals who are participating in a group but receiving one-on-one timed-based unit. So let's check it out. You can see here on my screen, I'm looking at the Medicare fee schedule. This is for Ohio and this is 2020. You can see 97150 reimburses $18.11. Since you're billing a single unit, you don't have to worry about the MPPR. That reduction will not take effect on a single unit visit. But when we compare that to something like therapeutic exercise, we're looking at 97530. You can see there's a dramatic $20 difference in reimbursement. That is significant, especially when we're looking at small groups. So what exactly is the group code? I would say the best resource to go to is the AMA CPT coding guide. But the second best resource to kind of get you to that point is information put out by APTA and some of the other coding websites. So APTA here has a great resource, and I'll post this link in the video description below this video. I'll also post a link to the AMA CPT coding book for 2020 on Amazon. If you don't have a copy of that or you don't have a recent copy, it's worth the $80. Go pick it up, have it at your desk to support the decisions you're making. But if we take a look at this, so we look at group therapy 97150, basically paying for outpatient physical therapy. It also includes speech and OT. Simultaneously to 2 or more individuals by a practitioner as a group therapy service. Individuals can be, but need not be performing the same activity. There needs to be something that connects the individuals. It could be the diagnosis, like you could be teaching a Parkinson's group class and everybody in the class is dealing with some sort of Parkinson's condition, but it doesn't have to be together by diagnosis. There's other things that can pull this group of people together. Based on its language, APTA understands the CPT code for group, 2 or more individuals, can be applied to different situations under the Medicare program. And this goes through like pool exercises, wellness. Well, it can't be wellness. Now, this is a clarification that we need to make. It still has to require the skills of a therapist to take the group through. That means that there needs to be some sort of medical complexities. There needs to be reason why a yoga instructor couldn't take this group through, a Pilates instructor couldn't take this group through. But that being said, that does not mean that this has to be your conventional, 3 sets of 10 single leg raise. This does not have to be the conventional chair exercises that we typically see. This can be a Pilates based program. You can even have a Pilates instructor involved in leading and directing the class as long as there is a physical therapist, occupational therapist, speech language pathologist, or an assistant supervised by a therapist on site, providing direct patient care to the group or to the participants individually. Now, I don't have time to get into this. This is here. This is available for you guys. There's even scenarios on what this would be like. But I want to spend the next 2 minutes just kind of explaining my understanding of the program. So if I had a group of 10 and that group of 10 received the untimed 97150 code, I would still be required to document. I would still be required to show medical necessity. There would still have to be a certified plan of care in place. I'd have all the same requirements as a normal physical therapy session, minus the one-on-one session. But if I'm doing a group of 10 and I'm receiving a single unit of $18 reimbursement, I'm looking at $180. Now flip that around And what if I have a group of 4 or a group of 6, and these individuals, even if they all come at the same time, even if they all come at 8 a.m. and they finish by 9 a.m., they're here for 60 minutes. Now, what if I circulate through this group, and each individual receives one direct care one-on-one unit of therapeutic activity? Instead of 97150, I provide 97530. I still have the same documentation, I still have the same time requirements, but now those billable minutes are billable as a time-based code. The reimbursement on a 6-person session instead of a 10-person session could be upwards of $220. I can still bring in the Pilates instructor. I can still provide so many resources that I couldn't otherwise provide if I was limiting myself to a one-on-one visit for 4 units. Sorry about that. So I think this is a real model. And even if this isn't something you're doing 40 hours a week, this is something you might be doing, during a typical slow period in the clinic. Maybe you don't have patients that want to start before 9 o'clock. So you take the hour between 8 and 9 and you do a group session providing one-on-one procedures to a small group, billing those procedures to each individual. Still supporting medical necessity, still providing the documentation, but then supplementing that with general supervised, non-covered, non-billable exercise programming, or meditation or yoga or Pilates or whatever else may be provided in that time. Guys, I think this is a real opportunity that's been on the books forever. These aren't new codes, these aren't new ideas. I'm just recycling these ideas and exposing you to ideas and concepts maybe you weren't familiar with before. If you have specific questions about how something like this would work, we're going to cover this in my Medicare billing course. This is part of the programming and the new modules that are coming out. But if you're not in that course and you still have questions, post them in the YouTube comments below this video. Guys, as always, I appreciate your time. I appreciate your support. Subscribe to the channel if you haven't, and I'll see you on the next video.